Dr. Andy Rosenfarb here. I want to talk to you about the benefits of castor oil and DMSO. This combination can be very, very useful and effective for some people dealing with certain ophthalmic conditions. So let's talk a little bit about it. First, what is castor oil? So we know castor oil is a useful oil that can be used as a lubricant topically. Historically, it's been used to help people who are dealing with dry eye issues, even cataracts. There's some research that shows uh, castor oil has been very useful for helping people slow down cataracts. Um, we also know that historically, castor oil has been used to help cosmetically, just to help with eyelash health. So that's castor oil. It's a lubricant, all right? It's an oil, obviously. So then what about DMSO? DMSO, or dimethyl sulfoxide, is a special carrier that helps nutrients absorb more deeply into the tissue. So it has a couple of benefits here. Castor oil is this carrier, so it's going to bring the castor oil deep into the structures of the eye, particularly the macula, the retina, the optic nerve. It's going to soften up the vasculature and basically turn your eye from beef jerky back into a nice, soft, supple, nourished tissue. Okay, so also, DMSO is an anti-inflammatory and it's a solvent. So what that means is it helps control and manage inflammation. It also can help break down anything that shouldn't be in the eye, right? Anything like pigmentation, like with Usher syndrome or retinitis pigmentosa, Stargardt's macular dystrophy. Also things like drusen. It can help break down drusen, the accumulated waste that can build up in the subretinal layers. That is very, very significant for a lot of people dealing with macular degeneration. Also can help absorb with bleeding, right? People who have had either eye strokes or wet macular degeneration or diabetic retinopathy where there's bleeding or leakage of fluids can be useful as well. Also, people dealing with retinal edema or macular edema, like cystoid macular edema or central serous retinopathy, can be very, very useful. Even after like an eye stroke, all the metabolites and waste products that have been built up in there can be very, very useful for help breaking these things down. So the potential benefits are for probably most neurological, neurovascular eye conditions, macular degeneration, glaucoma. It can help reduce eye pressure for sure. So when combined with castor oil and DMSO, they deliver a very highly nourishing and protective mechanism, not just to the surface of the eye, but again, the DMSO will help transport the castor oil to the deeper structures so that the structures of the eye will be moist, they will be supple, they'll be soft, flexible, and nourishable. Right, as our eyes age, our retinas age, our optic nerve age, and all parts of our body age, they start to dry out and they get more hard, brittle, and fibrous. So there are potential benefits for using this. And again, as we stated, we talked about most optic nerve and retinal and macular conditions, but it also can help with things like dry eye and provide deeper antioxidant support. We know castor oil is a very, very powerful antioxidant. Also, we're going to, of course, improve blood flow and circulation, right? We soften up the vasculature, we reduce the inflammation. It's going to help open the detox pathways and by improving blood flow. Also, we're dramatically improving the overall health and function, and as well as neuroprotection and neurovascular protection of both the nerves and the blood vessels. And of course, as previously stated, we also know that there's this anti-inflammatory benefit. So the one thing that I want to caution you guys is to make sure that you use a good product. First of all, we recommend the Bearcat Body product from Leslie Wright. It's currently the top recommended supplement for the DMSO castor oil drops. I'll put the link down there for you. And it's also very important to make sure you wash your hands, right? And any areas of your body that you want to apply the DMSO drops. For the reason is because the DMSO is a transporter. So if there's any dirt or anything, we don't want to bring that into your body. So we just want to make sure that you're clean. So best time to use is I recommend patients use the DMSO best after a shower or after you wash your face or something like that. And that includes eye makeup. So if you're using this for eye issues, make sure that you're removing all eye makeup for those of you guys who are wearing makeup. So that is my general synopsis of DMSO and castor oil. If you guys have questions, please comment below and let us know and reach out. And we're currently doing a research study in clinic to get more clinical data. But I'm really excited about this. I think that the DMSO castor oil, although isn't going to be a cure-all, but it's definitely a big piece of the puzzle to help a lot of people dealing with these neurodegenerative conditions, also including things like cataracts or just chronic inflammatory processes. So drop a comment if you have more questions, and we'll see you soon.